I'm Dennis Anderson, and here's what's coming up on Almanac North. Our series, Lessons from COVID-19, continues with a look at how local government responded to the pandemic, with a spotlight tonight on Ely. Next week, PBS's National Nova series focuses on rising infertility rates in America. We'll talk with the program's Minnesota-based producer. And Community Memorial Hospital in Cloquet will soon provide critical childbirth training for rural healthcare providers. These stories and voices of the region coming up right now on Almanac North. Hello and welcome to Almanac North. Thank you very much for watching. I'm Dennis Anderson. Julie is off this week as we alternate hosting during the pandemic. Minnesota Governor Tim Walz revealed a timeline this week to end the state's pandemic restrictions. Beginning today, capacity limits on outdoor dining and other events are removed, and bar and restaurant mandatory closing times have been removed. On May 28th, capacity and distancing limits will end for indoor events and gatherings. And finally, Minnesota's mask mandate will end no later than July 1st. Duluth Mayor Emily Larson announced an ambitious plan on Thursday to support the Spirit Mountain Recreation Area. The mayor outlined a plan to launch a $24 million capital investment program at the ski facility. If approved by councilors, that money would come from state bonding, city tourism taxes, and from Spirit Mountain. The Minnesota DNR has begun the process of terminating mining leases for Wasabi Metallics in Nashua. The company has been trying to raise money to finish the half-built Iron Range plant, but has failed to meet conditions which had been set by the DNR. The termination will be final on May 25th if the company does not comply with terms of its lease agreement with the state of Minnesota. And local and national observances were held Wednesday for Missing and Murdered Indigenous Persons Day. A White House proclamation called attention to the thousands of unsolved cases of Native women and girls. Under the Biden administration, a Missing and Murdered unit has been established within the Bureau of Indian Affairs. Our special series, Lessons from COVID-19, continues this week now as we explore local government response to the pandemic. How did city leaders communicate pandemic protocols to their residents? We sat down with Ely Mayor Chuck Novak to find out how his town navigated the pandemic.
The city has been wide open. Our resorts and lodging facilities have been here. And you can still see all the good things to see up here. The beauty of the country with the trees and the rivers and the lakes and everything. You don't have to drill a hole in the ice now to catch some fish. Everything's opening up. Food's available, lodging's available. Almost normal. Almost normal. I first heard about this down at the Capitol. We had a legislative action day with the Coalition of Minnesota Cities, and we were informed right afternoon to vacate the Capitol. The governor had put out his emergency order, and so we all left the Capitol with fist bumps and elbow bumps, saying goodbye to legislators and other mayors and council members, participants. And we all went to the hotel, checked out early. We had planned to be there another couple of days. Got in the car and went home. I put in place an emergency order for the city of Ely. And we're following the guidelines from the governor. And we did that for a couple of reasons. Number one, it brings it up to a higher level of understanding. Secondly, we have to have an emergency order in place in the city to be able to take advantage of support from the federal, state, and county governments, especially when we talk about the PPP funds. So we did that. It's still in place. It will stay in place till the governor no longer has it. And I think this is going to start coming to a head shortly. We've got the vaccinations going strong, starting from last year already. They were rolling out. And we got a pretty high percentage of our local population vaccinated. It was worrisome how the city would fare through it. The big concern came on finances. Restaurants were closed, bars were closed, a lot of the businesses here were closed until later on, which means would they be able to pay their property taxes? And with the property tax revenues, which cities rely on, would they be substantial enough to keep the city running? As it turned out, that didn't turn into a problem. Property tax receipts were in, people are honorable up here and they know their obligations and they paid their property taxes. So that was a good sign. The local government aid from St. Paul wasn't touched, so our budget was intact. Also made the statement that no city employee would be financially disadvantaged during this. We still have to provide services, so that was important. If we needed to cut on the budget, we'd find other ways to do it. The biggest challenge is, the city government does a lot. I mean, it just doesn't sit around waiting for something and throw money around. But we can't solve a problem the city's not made aware of directly. We've supported things like ECR, Ely Community Resource. That's an excellent, excellent resource. The library has been closed to indoor access, but we have pickup service. There were some people who were concerned about the level of visitors that come here. They accommodated. During the summer, we had this partial opening with a 25% capacity in our restaurants and that. We don't have that many restaurants of concern, but mostly takeout was the venue. The culture has changed. You wave at people, sometimes they turn away because they don't want to engage anymore. And so there's been an attitudinal shift in how people relate to each other. Try to be friendly people. Not everybody's threatening everybody anymore, We haven't gotten that culture up here yet. We're kind of an open and friendly society up here. The lessons from COVID is document the history of this event and bind it so it's available, and then every so often should go through the lessons learned as a refresher with our departments of health and in the state and health departments in the counties and the federal government to always plan for another event to happen. Don't ever get so comfortable that you think it can't happen again.
Next week, our special series continues as we look at the major impact of COVID-19 on our school system. We will talk with the Hibbing School Superintendent about the struggle schools faced and the lessons they learned.
A lot of people will remember the day that Pearl Harbor was attacked, or D-Day, or other famous 9/11. I'm going to remember March 18th for the rest of my life. That was the day that the governor announced that we were all, in the state of Minnesota, all districts were going to distance learning. There was frustration, and I think there still is frustration. They're not perfect by any means. We heard many stories of families parked outside of McDonald's doing their homework on their iPad because they had, they couldn't get anywhere else to get Wi-Fi or connectivity. That was really our focus for a large chunk of this pandemic, was how do we get kids fed and what do we do about mental health? And education is always in the background, and it's always important, but it really took a back seat for a lot of the pandemic. It was about basic needs of students, not about rigor and curriculum.
The superintendent believes one of the biggest mistakes schools and the state made was assuming everyone had internet connectivity. Students especially struggled with this in many rural areas of northeastern Minnesota. How school staff came together to respond to students' needs as best they could, next week on Almanac North. According to a recent report, the U.S. could see a shortage of 22,000 OB/GYNs and obstetricians by 2050. The shortage is more severe in rural areas where many counties do not have a practicing OB/GYN. St. Luke's announced last month their Laurentian Medical Clinic in Mountain Iron now has a board-certified OB/GYN offering a full range of services, including fertility consults. As fertility care options expand on the Iron Range, there's a national discussion now evolving on assisted reproductive technologies. The causes of infertility and the structural inequalities faced by those experiencing fertility challenges is the focus of next week's Nova Science series. From Minneapolis producer Larkin McPhee.
My name is Larkin McPhee. I am a producer, writer, director of documentary films, and I'm currently been working with Nova on a film about fertility, which will be airing this May on PBS. We actually went around the country to tell stories. We began in my backyard here in Minneapolis. It's a very experimental time right now.
Infertility just feels like a special little corner of hell.
I think there's an infertility pandemic, and I think it's getting worse.
Black women are struggling with infertility at almost 2 times the rate as our Caucasian brothers and sisters.
One thing that people would always say is that 2 men can't make a baby. And so I'm sort of like, watch us.
Fighting for fertility on Nova.
The story of the trans male that we cover in the film is a story of a person who's been very stigmatized, for most of his life. And he finally figured out that he was trans and said, I want to transition. Never thought about fertility, and nor did anyone counsel him. So when he did meet his partner and fell in love, he felt suddenly, I think this could be a beautiful thing to have a child with this man. And these 2 men had a baby, and I'd like you to watch the show to learn how. but it's a really good story. I think the number one message is there's many ways to build a family, and the technology is allowing that. And yet at the same time, infertility is extraordinarily challenging for people. This film is featuring several different couples facing hurdles that abound in the world of fertility. So male factor infertility, which is falling male factors, it could be falling sperm count, could be problems with the shape of the sperm, so forth. We're looking at mosaic embryos, which is a controversial embryo, but as science, is catching up to what this embryo represents, it may be an embryo that more and more people can consider transferring and using. So we're capturing cutting edge technology in this film. We're also looking at the LGBTQ community and the challenges and hurdles they face. And very importantly, we're looking at the structural inequalities in the African American community. African Americans suffer infertility at rates twice as high as white women. Why is that? As we've seen with COVID, their health is more compromised. And part of that is a phenomenon called weathering, which is generational oppression, racism, that literally has caused their bodies to prematurely age. And this is impacting, infant mortality rates, fertility rates, all sorts of things. And added to that are myths in the African American community, that they're hyperfertile, which is not true. And they don't necessarily seek out help, or maybe not as readily as others. And that's because there's been the history of reproductive coercion in their past. And there's also been a mistrust because they feel that sometimes in doctors' offices, their concerns are dismissed. And so these things all sort of gather together and contribute to some of these, higher rates of infertility. One area that's very challenging in the world of fertility in the United States is the rural areas, because it's an issue of access. And we've seen that play out in the African American community, but it's true for everybody. I think that if we're in a society now where we're delaying childbearing time, that you're going to run into more problems because of the aging egg and other issues around sperm, whatever it is. And so you're going to want to have clinics and available to you. And this is a challenge. This film is about the infinite possibilities that technology is affording us today for people to have choices. And that, everybody wants to have the opportunity to build a family. And I think that is one of the things that we're reporting on in this film, is updating people on how that's happening.
And you can watch Fighting for Fertility on Nova next Wednesday, May 12th at 8 p.m. on PBS North. And visit the WDSE Facebook page for a digital extra story on the importance of OB/GYN services in rural Minnesota. Rural doctors and hospitals tend to have less experience delivering babies, especially in complicated or high-risk pregnancies. But soon, Community Memorial Hospital in Cloquet will be able to train doctors and nurses in greater Minnesota, giving them more experience delivering babies. How will they do it? Rick Brewer, the CEO and administrator at Community Memorial Hospital, is here to explain. Rick, thank you very much for being here tonight. This is fascinating. This is live birth simulating equipment. What does that include?
Boy, thank you for letting me.
It's almost a mother.
It really is. Thank you for letting me be here. We're so excited to start talking about this. This simulation equipment really can replicate almost every conceivable normal obstetrical, medical, and surgical scenario that you could envision. So from the straight up vaginal delivery, covering a number of different presentations and nuchal cord and shoulder problems and all kinds of things, to working through C-section scenarios, looking at fetal extraction, vacuum-assisted deliveries, all the way to hemorrhages, postpartum hemorrhage, bleeding situations, and emergency hysterectomies. You really can cover a full gamut of things that both physicians and nurses and other providers can all work through.
I would imagine this kind of training with such a sophisticated piece of equipment can do nothing but assist mothers and babies into a successful live birth.
That's exactly right. What we find and how you would introduce this piece is exactly right. There aren't as many babies being born in these rural areas. Rural communities want to be able to offer obstetric services, and the ones that still are, it's really important to them. It's not a financial consideration. Yeah. OB doesn't pay for itself. That's not why we do it. We do it because we know it's important.
Sure.
We know that all else being equal, the farther a mom has to travel, the worse the outcomes are for mom and babies.
How was Cloquet Memorial chosen to do this?
We pursued this. This has been a mission of mine for almost 5 years. We can go all the way back to a doc we hired who needed some proctoring, just needed some extra deliveries under her belt, and we struggled to find places we could send her to kind of be immersed. Small places were more willing to help than large places, but they didn't have a lot of babies either. So we pivoted at a certain point to simulation equipment, and we found the world has dramatically changed since Resusci Annie in 1960 came out. Yes, that was 1960.
Wow.
So now you really can get a true lifelike experience in obstetrics. Studies have shown that medical students coming through with this kind of training actually outperform their classmates if the traditional training is backed up and complemented by this simulation training. We want to take providers already in the field, these physicians, these nurses, these other folks at hospitals delivering babies and non-birthing hospitals, and give them the opportunity all across rural Minnesota to come in and get high-value, low-cost training. So we chased this down. We reviewed products. We chased funding. This is outside the reach of a rural hospital on its own.
So will all the training be done in Cloquet then, and healthcare providers will come to Cloquet to be trained?
That's correct. And we've lined up so docs and nurses can get continuing medical education. We have received grants to fund all of the equipment up front. Blue Cross Blue Shield of Minnesota has paid for that. The Office of Rural Health through the Minnesota Department of Health is helping us with ongoing expenses.
I have time for one more quick question.
Sure.
So who does the training on the simulator? A physician from St. Cloud, from Cloquet?
We will have physicians and nurses and OB nurses who are going to be trained as trainers to run these simulations. So they'll be training all of these docs and nurses and EMS providers all across the state able to come there.
Rick Brewer, this has got to be terribly exciting for you and for your hospital.
It very much
it will
is.
be for the public.
I'm a rural kid. I grew up in rural Minnesota. This is going to help a lot of folks across rural Minnesota.
All right. Thank you so very much for being here tonight. Thank you.
Thank you.
It's time now for Voices of the Region. Each week we hear from an area journalist with more on the stories they are covering. This week, Northern Minnesota author and columnist Aaron Brown is our guest.
One of the big challenges here is that PolyMet is what they call a junior miner. They are a new company that wants to essentially sell a viable project to a larger miner. And in fact, they've already done that in their relationship with Glencore, which is now the majority owner of PolyMet. And so they're packaging a proposal to become a mine that will be operated by a much bigger company like Glencore, which is a global giant. And so the ruling really just highlights that they've tried throughout this process to keep their costs and legacy costs low to attract investment in the mine, which is $1 billion mine. I mean, most of us don't have $1 billion or can even fathom of $1 billion. And so to get $1 billion invested by Glencore and other investors into this project, they want to make sure that they don't commit to long-term costs. And the whole environmental criticism of the project is really its long-term post-mine cost. And the ruling really highlights that. And I think to get a breakthrough, you've not only got to have the money, which is a challenge in any economy, even a good one, but also that an answer on those long-term costs, for mitigation costs for after the mine is done with its operation. So steel prices are really high, and the mines on the range are, running hot, as they say. They're producing lots. The question, the interesting question will be how this influx of really big profit coming in over this next year, how companies will address that. You've seen some different strategies. Cliffs has built up now the biggest steel company in America with its recent acquisitions. It's trying to pay down some of its debt, but also continue investing in modernizing its plants. U.S. Steel, which has had, I think, more money problems of the last few years, is almost trying to exclusively pay back some debt. And I think there's some feeling, I certainly would sense the idea that the next boom would be maybe a big one, because now with Cliffs having consolidated a couple of the big companies, we could look at maybe a taconite plant closing or being consolidated in operations with another plant somehow in the next bust. So maybe it's just living and growing up on the Iron Range. You can't really feel a boom without anticipating a bust. But these companies are being very strategic, and it will be interesting to see how their decisions play out in 2 or 3 years when maybe the steel prices aren't quite so high. I don't know anybody who wasn't at least partially surprised that Minnesota keeps its eight districts. We knew the population of Minnesota would go up, but we found that it was going up faster than all of our neighbors here in the upper Midwest, and that it was actually keeping pace with national population growth. In other words, Minnesota really kind of exceeded expectations across the board in our census response. Part of that is that we're really good at responding to paperwork. I think it's a statewide skill. And therefore we really thrived in the pandemic census environment, and we got all of our paperwork done. Whereas the other state that's getting a lot of attention, New York, had a harder time and probably undercounted its people a little bit just because of the COVID situation in that state when the census was being taken. And we're the beneficiaries because we keep our 8th, but New York loses its 27th seat in the new reapportionment after this census. So we keep our 8 districts in Minnesota. Our 8th district in northeastern Minnesota, northern Minnesota will stay, I would guess, mostly the same. It is one of the slowest growing districts in the state. It's got a lot of territory to pick up. But I've seen some estimated guess maps that show, we could do it relatively easily, picking up some ground up in the northwest part of the state. Any further south, and you're really getting into the 7-county metro area. So it's unlikely that the judges who will actually decide redistricting would do that. They try to change as little as possible. And I say judges because normally the legislature would set the districts, but because we have a divided government in Minnesota with Republicans and Democrats, there is no chance they will agree on a map. I'll just say it right out the gate. There's no chance.
Keep up with the latest from Almanac North by following us on social media. You'll find us on Facebook and Twitter, or visit the WDSE website for the latest program updates, news about the station, and our upcoming events. And download the PBS video app for on-demand viewing of your favorite programs. Thanks to our guests and the crew here in the studio, I'm Dennis Anderson. Stay healthy, everyone, and be kind.